using nitrous. And they put it on me, and I had to rip it off. So anyway, here we are. I'm Fran, your holistic hygienist. I want to welcome everybody to the webinar tonight. I want to thank you for taking your time out on a Thursday evening to listen to some great ways of being able to alleviate your anxiety or your fear of going into the dentist, because unfortunately that is fairly common, and that can actually become a huge problem for many reasons, which we'll talk to you about in a moment or two. So I want you to sit back, relax. I want you to take some notes. I want you to ask questions. We have a box below that you'll be able to put in the comment box to ask your questions, because we'll address those at the end. So we're going to be talking about relieving dental anxiety naturally without the use of chemicals and pharmaceuticals. And we're going to start reviewing that with you right now. But a little bit more about me. For those of you who don't know who I am, my name is Fran Horning. I am a dental hygienist, and I've been one for 35 years. I am working in the holistic practice with Dr. Gushinsky for several years now, but I've started practicing holistic dentistry back in 1984, almost at its inception. So I have a few years under my belt doing this, and I am a proud member of the International Academy of Oral Medicine and Toxicology. I am also on the board and a member of the International Academy of Biological Dentistry and Medicine, the Holistic Dental Association, and the American Academy of Oral Systemic Health. So a lot of those alphabets after my name basically just says I like biological dentistry, and I think it's an awesome thing. So I like to learn a lot more about it, so that way I can help you live a long, healthy dental life. So that being said, we're going to get to our next topic. Now, when you have to go to the dental office, do you feel nice and calm and relaxed? Oh, I can't wait to get my cleaning. That's exactly what we want you to feel. We want you to feel nice and calm and relaxed. But unfortunately, a majority of people really feel like this. The thought of having needles and drills and all these things in their mouth, it just, brings up a lot of negative feelings and a lot of negative emotions. And, there are definitely many ways to address that. So I want to talk to you about how you can do that for yourself at home, or things we can do for you here. But I want to be able to empower you to be able to help yourself too. So basically, let's talk a little bit about anxiety and fear. About 82% of the population have some level of anxiety. What that means is it could be as much as like, oh, I hate to go to the dentist. I don't want to go to the dentist. Oh, the thought of them poking and prodding me, I just not interested, to the point where it's actually paralyzing fear or phobia. So sometimes anxiety is used to encompass all of it, but actually there's different levels. And we can measure that by asking you some questions and by you being open with us, because we can actually be able to figure out what would be the best way to address your level of anxiety or phobia. A lot of times, that dread will even prevent you from picking up a phone. So this is something that's very important, because if you're not going to your dentist, it's not just about your teeth. It's also about your health, because all the research and studies are showing that if your mouth is not healthy, your body's probably not healthy, because you can have an increased risk of heart attack and stroke, diabetes, Alzheimer's, rheumatoid arthritis, pancreatic cancer. I mean, the list goes on and on. So, believe it or not, your mouth is attached to your body. So if you're afraid to come on in, we can't help you. So we want to be able to address these in a nice chemical-free way, if this is so what you choose. Now, at that next level of anxiety is the ones that don't go into the dentist at all. There's about 60 million people, 1 out of 5, that refuse to go at all. They'll put up with broken teeth and unsightly teeth and pain. They'll stay in pain because they'd rather just, take some pills to relieve the pain than the thought of going to the dentist, which is really something that breaks my heart, because I really feel that we have options for you to be able to teach you how to alleviate that, and then ways that you can use here in the office to alleviate those fears. So, you know, we are happy to provide this information to you. Now, the anxiety, stress, and fear are dominant factors in what helps and actually governs your behaviors. And so, actually, dental fear is equated to like public speaking. Now, I do a lot of public speaking across the country, so I can kind of understand that. Thankfully, I don't have a dental fear, but you know, it's pretty paralyzing when you're up in front of a bunch of people. So I can imagine a patient who has a dental fear sitting in that chair. You have that same crushing fear for a moment. And so, but most people who have not seen the dentist regularly or have not gone for years, they say that fear is the main cause of why they haven't gone. So there's definitely a lot to be said about these things. So you can have a perception of fear, whether the anxious response is because of something that's real or something that's perceived. If you have a tiger or a lion running after you, you're running, you're booking because your fight or flight response. There are two little things in your brain. There's a fancy word for them that are called amygdala. And they're shapes of almonds. They're in the midbrain, and that's part of your limbic system, which governs your fight or flight. So we all know that panic-stricken, oh my God, I'm going to be eaten alive kind of a feeling, and you start running. So that's a real fear. But the thought of having needles and drills in your mouth, that can actually elicit the exact same sensation, because those two little parts of your midbrain are actually being activated the same way that the sight of a lion running after you would have that same sensation. So it doesn't matter. You'll have memories that are stored in your brain from, you know, a bad experience that maybe you've had as a child, or you were with a parent who had a bad experience and you witnessed that. So whatever it may be, those memories stay in there, and they are now relived every time that that you go to a dental office. So we're going to find ways of actually breaking that cycle for you. There's some ways for if you're just slightly anxious, there's nice ways to do that. And then there's other ways of really just breaking that cycle of fear. So that way you can actually pick up that phone and call to get the dental treatment that you need. So if you're in that fight or flight sensation, you can't reason. So it's really hard to know. I mean, you know that we're trying to help you, and we're doing things for you, but to you, we're doing things to you. And that's not the case. We're actually doing things for you. So it's really hard to process everything when you have that anxiety and fear. So that's one of the main reasons why we really want to help you feel better about it. So what happens when you're in the chair? Okay, these are just some things that happen. I'm sure you're probably very aware of it. You start gagging. You know, there's too much water. You need to rinse out a lot. That's basically not so much. There could be an actual real gag reflex, but some of it is out of the fear of choking and such like that. Tongue battles. Your tongue wants to know what's going on, and sometimes that could be a little dangerous because if we're drilling a tooth or if we have sharp instruments. So basically, trying to get the body to relax because that fear that is kicking in, and so the tongue is going all over, which can potentially be a problem if we accidentally touch it with something we shouldn't. Excessive salivation. We start salivating a lot because of our nerves are going, which can make it difficult because then you have to spit out a lot, and it's hard for us to see, but it's very difficult for you. And then clenching your jaw, you want to close because you're trying to protect yourself. It's a self-protection mechanism. So you'll start closing and you'll start clenching because you don't want anything to get in there. So again, that could be very harmful to you. And then stalling, you'll find every which way to not let those needles and drills get in your mouth. And, I could totally get it, and I understand. But these are all things that we can address. So if this fits the bill for any of you, we have ways to help you. And then clutching and grabbing, that fear, you start grabbing for our arm and such, which can actually cause more harm. So we want to be able to help you with that fear and anxiety. And then unpredictable movements again. This is all part of that anxiety, which we have ways to address. So we need to give you safe, reliable ways of addressing it, like I said before. You know, there are ways of doing it with chemicals and pharmaceuticals. Do we give you muscle relaxers? Do we give you things like Valium and Xanax and Haldol, and that can actually make you loopy and goofy, and you can't get around? Or, you know, do you prefer something that will relieve your anxiety, but leaves you aware of your surroundings? You know what's going on. You can see what we're doing. You can have that sense of security, knowing that you're not out of it. So here we're going to talk about a few ways that we can do that. First and foremost, we have essential oils, which I'm sure everybody knows. The king of essential oils is, of course, lavender oil. Now, lavender oil is a well-known antimicrobial, antibacterial, antifungal, antidepressant. It helps with stress and anxiety. There's a lot of esters in it. Esters are those molecules that can help go through in your nose and your olfactory system, and it kind of changes. It physically can change how you perceive or your reaction to things. So lavender oil is a great way to reduce your anxiety. You can see here just a quick anecdote. I'm going to use a study here that shows that they put people in a room and they diffused lavender. And this study showed that the lavender oil significantly lowered their anxiety. So it's not just an anecdotal, well, lavender smells great and that it might help you. No, we have a study here that shows that it actually really does work. So that's a nice, simple way to be able to reduce your anxiety. Another thing we can use is orange oil. Now, orange oil is more of an emotional, happy oil. It gives you a sense of security. It actually also helps reduce some of the cortisol, which is the stress hormone. So it reduces cortisol, reduces the stress hormone. You're going to feel much more relaxed and much more happy, and has positive emotions, and it affects the limbic system, like I said before, which is your emotional part of your brain. So they've also done studies that, you know, the orange and the lavender oils both significantly reduced and improved the mood in people who were waiting to go in, and they diffused it. Now, I'm going to talk to you about doing things with these essential oils that are not necessarily diffusing them, because I'll explain to you when we're done why. So now, how do you use the essential oils? If we're not going to diffuse it, we can, but I think it's best for you to be able to take control of it. You can put some on your wrists, you know, just a little dabble, do you, on the wrist. That way you can continually just sniff. Or if you have your essential oil bracelet, you can put a little bit in your bracelet. And they actually make even other bracelets that have like a lava stone that you can use. Or if you have a handkerchief, you put a couple of drops of essential oils on the handkerchief. Or if a woman has long hair, you put a drop or two on the long hair. Or on the bib, you can put a drop or two on the bib, and that way you'll have that ambient lavender all around you. So this is a nice ways that you have full control over when you need it, and you can use it as you see fit. Now, there's another way to do it. These little roller balls, these bottles, I love them. I personally use them. There's different essential oils. So there's one company that I really love to use, and I get my bottles through them. You can take about 20 drops of the lavender or the essential oil, and then you put it in the roller ball, and then you fill it up with the fractionated carrier oil, like that will be either jojoba or coconut oil or almond oil, any of these oils that can dilute that lavender. You put the ball back on, and then you can just use that on the back of your neck, on the nape of your neck if you want. Again, you can put it just a little dab right here onto your nose, you know, because it's diluted, because you want to be careful. Even though supposedly, I'm going to back up a little bit, lavender is supposed to not irritate your skin. I was telling you to put it on your wrist. I would probably still dilute it. Just take a little bit of coconut oil, put a drop or two in the coconut oil, and then put it on. I wouldn't put it on directly. But this is a nice way of having this rollable bottle. You can carry it with you in either your pocket, for men, for women in their purse. This is a nice way. You can use it at any time, not just here in the dental office. So it's a great, great way of being able to address any of your fear or anxiety. Now, here's another one. I actually really like this one. This kind of reminds me of, the little Vicks inhalers that I used to use when I was a kid when I was sick. But you can get these little inhalers super, super, super dirt cheap. And you take out the wick, and then you put about 3 to 6 drops of the essential oil on the wick. You put it back in there, and then here you have your own little, little essential oil thing that you can sip again anytime that you need. So this way, you don't necessarily, if you don't want to smell like lavender or orange all day long, if you don't have to put it on your skin, you don't need to put it on your bracelet. You can have it here in your wick, in your inhaler. And this is, again, another thing that you can carry with you, either in your pocket or your purse, and you could take it wherever you need to go. And then it's something that you just have to refresh and just put a couple of new drops if it's, degraded after a while. So it's a really, really nice thing to do. Now, one of the reasons why I'm not a huge fan of diffusing lavender oil, you're going to think I'm crazy for saying that. That's the way people usually use it. The orange oil, I don't have a problem with, but I personally have a problem if you're in the dental office using the lavender. I'm going to explain to you why. A couple of years ago, I had looked at my schedule, and I saw that I had a couple of patients who were anxious, a little anxiety. I said, great, this is going to be a wonderful day. I'm going to get my diffuser, and I'm going to put lavender in it, and I'm going to diffuse it all day long, so my patient's going to be great all day. I don't want them to have any kind of fear or anxiety. So I started it first thing in the morning, and the lavender's going all day. And it was probably maybe around 2, 3 o'clock in the afternoon. I'm working on a patient. And then all of a sudden I hear the front desk, one girl says to the other and goes, man, I'm so tired. I don't know why I'm so sleepy. And then the other one's like, yeah, me too. I could just fall asleep. I could put my head on the desk and go right to sleep. And I'm hearing them talk, and I went, oh, I'm putting them to sleep by them smelling the lavender oil all day long. So that's why I like to recommend, if we're going to do the orange oil diffuser in the office, or having these personal things. That's why I wanted to really stress using the personal inhalers. This way you have what you need when you need it. All right, so that's it with the essential oils. There's so many essential oils. We could talk all day long and how many more applications, but I want to try to keep this as simple as possible for you. So we're going to go to the next topic, which is emotional freedom technique. Now, some of you may know what that is, and some of you may not. Emotional freedom technique basically is a way of tapping. Now, tapping is meant to be used on acupressure points. So I'm going to explain to you exactly what that means. In ancient Chinese medicine, you've heard of acupuncture, right? And then you've heard of acupressure. Now, when you're using tapping, you're hitting some spots on the body that will hit meridian points on the body that will help block or help clear a channel, so that way you're going to get a positive response. So if you're thinking of a stressor, like if I'm thinking, oh, I got to go to the dentist, oh my God, I can't believe I have to go to the dentist, that's going to activate that part of your brain, like I said earlier, those amygdalae, those parts of your midbrain. So you're now all of a sudden going to have that fight or flight response. So by hitting certain spots on the body, you're going to block that stimuli. And that way you're going to be able to eliminate that fear. So let's talk to you a little bit more how that works. Meridians are pathways that energy runs through. Back in 2013, there was a Korean study that proves beyond a shadow of a doubt that there is such a thing as a meridian. It's not just anecdotal. It's not just, hearsay. They're real. So if we have real pathways in the body, and then by activating them by either using acupuncture, acupressure, or tapping, you're going to be able to get those pathways free and flowing, and you're going to remove blocks. Okay, because the blocks, as we talked in our last webinar, those blocks in our meridian system can cause disease and negative things in the body. And then for this instance, in fear, it's negative emotions. So we want to be able to eliminate those negative emotions. Okay. So how does it work? Basically, like I said, these are Harvard studies. So it's, again, this is not just, because I think it works and because I do it, it works. No, Harvard studies are showing that if you're stimulating these certain points, you're actually decreasing the activity on the midbrain that is causing that fight or flight, that lion's running after me, or that perceived fear that, needles and drills in my mouth. So basically you are blocking and stopping that activity. And they've actually done PET and MRI scans that show that it really does stop the activity in that midbrain. So you are really, you're self-medicating without medication. You are able to block these receptors just by touching certain points. Now, tapping can be used for a multitude of things, for weight loss, for, this and that. But we're just going to talk about fear today, okay? So here again, when I think about my fear, whether it be fear of snakes or fear of the dentist or fear of whatever. So I'm going to say fear of the dentist, obviously. So I'm thinking about, fear of the dentist and how it makes me feel. And when I start feeling those emotions, you start tapping. So you're tapping those meridian points. You're going to be able to block those spots. And so now you're decreasing that activity in the midbrain. So now you're going to be able to clear it. Make sense? If not, you can always ask questions, and I'll be happy to answer that for you. So here's a study that shows that emotional freedom techniques treatment demonstrated a significant decrease in anxiety scores, even when accounting for the effect size of controlled treatment, which means that these studies are showing that it is extremely effective. Again, these are real studies that prove beyond a shadow of a doubt that these work. I mean, if acupuncture works, then acupressure or acupressure points are going to work, right? So here was another study where they took people and they asked them, okay, what is your score? Like, what do you, from 0, like, I'm chill, I'm good, really great, to 10, where, oh my God, I'm about ready to jump out the window. I don't want to be here. I am so panic stricken, and my anxiety is like through the roof. So they asked them to evaluate where they're at. So they said, most of them said they were about an 8, which is pretty high, okay? So they did a series of tapping, and they were able to get themselves down to a 3, which is pretty good. And again, we're not using pills, we're not using medications, you're not using chemicals. Now, if you get yourself down to a 3, you can probably do another series and maybe even get yourself down to a 0. And you are fully in control. You are in control of how you're going to react. It's a great, great, great thing. So, tapping points. And how do you do it? Some of you may know how to do it. Some of you may not. So what I'm going to do is I'm going to take it, pardon me for adjusting my earphones here, because I want to be able to show you how you can do it. So I'm just going to adjust my screen here. So basically, there are several points on the body. You're going to get the top of the head, that's a meridian point. You have the side of the eyebrow, that's a meridian acupressure point. The outside of the eye, under the eye, right about where your bone is, right about there. Under your nose, where you got that little fold right there. Between your nose and your lip, there's like a spot right in the middle, right there. And then you have a spot between your lip and your chin, that little crease right in there. And then you have your little clavicle points. Pardon me, I can't figure out where they are because I'm a reversed image here, but your clavicle points. And I'm going to show you how you can do that a little bit differently. And then you have under your arm. And then lastly, it would be the top of your head. So what I'm going to do is I'm going to do 1 cycle for you. And then usually you would do 3 cycles of this. And that usually gets you to a great place. So I'm going to do 1 cycle, and I'm going to say about how I'm fearful of the dentist. Okay? So we're going to get started. We're going to start with the side of the hand first. That was my first spot. See, I missed that one. You're going to start with your karate chop. Now, when you have a larger spot, you want to use more surface, so you can use several of your fingers. If you have a small spot, you can use 1 or 2 fingers. So the larger the spot, the more surface you want to cover. So basically, you're going to use the side of your hand and you're going to start tapping. Now, you don't want to hurt yourself, but you don't want to, like, you know, barely touch yourself either. So like midway, you want to really kind of get into that meridian acupressure point. So I'm going to start saying things like, I got to go to the dentist, and it's bringing up so much fear, but I truly love and accept myself. Going to the dentist really makes me very stressful, but I truly love and accept myself. This stress, this fear, this stress and fear is taking control over me. This stress, this fear, and this anxiety, I can't take it anymore. Now, when you get here, because there's 2 points, you can use your hand and you can slap. So that way you get both points at the same time. This stress and this fear is taking control. This stress and this fear and this anxiety is taking control. This stress, my anxiety. So basically, that's your patterns. Start with your hand, side of the eyebrow, side of the eye, under your eye, under your nose, under your lip, your clavicle or your little points here, under your arm, and then the top of your head. You're going to start with your stressor, this dental fear or whatever. Start with that. And then you don't have to say that each time you're tapping a point, because you've already activated those little points in your midbrain. So you do that whole cycle about 3 times, and you should be able to reduce your anxiety back down to the 3, like the study showed. So that is our goal, is to get you to a point where you're going to feel really, really comfortable to sit in the chair. And what's nice about doing this, you're in full control. You can do it when you need to. You can do it before you come in. If you're sitting in the chair waiting for the doctor, you can do it again. I mean, you are in full control without chemicals and pharmaceuticals. So this is why I like this so much. And actually, I'm in the process of actually getting certified. So excited about it. Anyway, so here we have tapping, which has been proven to be very, very effective. And it's another way that you can control. So you have your essential oils and you have your tapping. Now, next, we have, if my computer will go, we have homeopathy. A lot of you may already know about homeopathy. This is a great way of helping you without, again, knocking you out, basically. So, for those who don't know what homeopathy is, basically it is like cures like. Dr. Samuel Hahnemann, back in the early 1800s, found that if he took certain substances, usually more botanical things, there are some animal, but more botanical, plant-based things, that if he diluted them enough, it could actually do the opposite, like belladonna. Belladonna is not so good, but if you dilute it, it actually reacts differently, the opposite way. So basically, the homeopathy is a way of reducing anxiety without making you feel that loopy, out of control sensation by using certain ones. And there's several different ones, but I'm just using 2 that are the easiest ones to do, because I don't want people to get overwhelmed. You can always ask more questions, or you can come in and we can review with you too. So homeopathy is so popular that Queen Mom, who she's got a big event tomorrow, no, actually Saturday, if those of you are following, She will only go to the Royal London Hospital of Homeopathy. She will not use anything but homeopathy. Her doctor, Robert Harris, is a huge proponent. He says that he does not feel that we are using it enough, and I have to agree with that, because it's easier to pop any kind of pill than maybe just trying to put a little effort into using some homeopathy, which is a more natural, more safe way of addressing many, 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 many ailments. But again, we're just talking about dental fear and anxiety today. So the king of homeopathy for anxiety is Aconite. Now, Aconite is a wonderful, wonderful way to reduce anxiety because it reacts immediately. Now, for those who don't know what homeopathy is, like I said before, these are tiny little sugar balls, like little pellets. You'll see here, this is a recommended 5 pellets. That's not a misprint, and I didn't spell it wrong. That's actually what it is. It's a pellet. You know, so, well, she needs pills. No, pellets. They come in different sizes. It's basically a sugar. It can be really, really, really tiny or a little more moderate size. And the essence of the botanical or plant or animal substance, but mostly botanical, is in that sugar pill. So basically, you take those pellets and put them under your tongue and let that get into your bloodstream, and that is enough to get you nice and relaxed. I did public speaking about a month and a half ago. I gave a presentation similar to this in front of a huge audience. And you know, I took some Aconite before I started. And I have to tell you, it worked beautifully. And I was on point. I was able to give my presentation without feeling anxious or flustered. And I wasn't knocked out. So it's a great thing. So Aconite is used when you have that sudden fear, that you have that impending doom, that you're panic-stricken and you're emotionally restless. That's like that sudden onset of like, oh my gosh. That's when you use Aconite, because it is an immediate relief. You can use it here in the office. We can give it to you right before your general treatment, or if you have it at home, because it's relatively available, you can take it the day before. You can take it the night before. You can take it the morning of, and then 45 minutes right before your appointment, So when you're here, everything is just beautiful. You know, you're going to be able to have the dental treatment done without that panic-stricken feeling, and then you'll have enough in your system that you'll feel that nice, relaxed sensation, which most of us do want to feel. It's a great thing. Now, the next one, we have Dulcemium. I call it gels for short. That is when you have that weak knee, like your muscles, or you're like, oh, I'm about to faint. Oh my God, I have to run to the bathroom. All of a sudden now you have diarrhea because now your stomach's churning, your muscles are weak, you're about to ready to collapse, and you know, you have the runs and you're running to the restroom. That's when you use your Dulcemium. So it really depends on how your fear manifests physically. So this is a great way of having 2 options of being able to address the fear, how it manifests. So with the gels, if you have that nausea, diarrhea, sleepy or weak knees, or like you're about to pass out sensation, that's when you take your Dulcemium. Again, you can take it right before when you come in here. But what's nice, if you take it the day before, the morning of, and right before your appointment, you'll have enough going on in your system so that you'll get a nice reaction from it. That's why we like it. And plus, you're not going to have that knocked out sensation. So these are 2 great ways of addressing your fear with homeopathy. I've had several patients who didn't know what homeopathy was. I was able to use it for them, and they're like, wow, yeah, that stuff was great. It really helped. So I was very, very happy that I was able to help my patients do that. Now, here's another homeopathy. This is the Rescue Remedy, which a lot of you may have heard of. This you can buy in any of your large chain organic stores, which I'm not going to name. I'm sure you know which one. And you can order it online. It's a great way. There's like 5 different flowers, impatiens and other flowers, that is very beneficial in reducing their anxiety and all that. So it's actually in with an alcohol that dilutes it. So there's a spray and there's a dropper. So it depends on which one you like. I actually had a patient who used this a while back, but I'm going to tell you in a second. The results show, there is another study that showed that the rescue remedy was effective reducing high levels of situational anxiety. But again, depends on your level of anxiety. If it's fairly manageable, I mean, you have that anxiety, this is probably a great solution for you. But it's not too bad. I had a patient, it was a new patient. She hadn't been to the dentist in quite a few years. And she was telling me about how anxious she was to go to the doctor. So that's why she hadn't been. And I said, oh, you're talking to the right person because this is what I talk about. And she's like, no. I said, we have all these things we could do for you. She goes like, no, I'm okay. I actually took rescue remedy last night and this morning, and I'm cool. So I was able to do work for her, and she was totally okay. And this was only about maybe a month and a half, 2 months ago. So before I gave my presentation in Denver. So it was great. A great feedback, because I know the studies, but to hear feedback from patients, and she said it was great, it worked. So here is another way you can control how you can address your anxiety, so that way you can get the treatment that you need. So that's why I want to bring that up also. Now, here's another way. We have cannabidol. Now, there's a lot of controversy about this, so we're going to keep this pretty straightforward. I'm not going to give you a lot of anecdotal information on this. We're going to keep this as straightforward as possible. What is CBD oil, actually? Because there is a bit of a misunderstanding of exactly what it is and how it's derived. And what is the difference between CBD oil and hemp CBD oil? So there's a big difference, so I'm going to talk to you a little bit about that right now. Hemp and cannabis is the same family. Just like you can have flowers, you can have a rose, you can have a lily, you can have a tulip, you can have a lilac. They're all flowers, but they're different flowers. So that's what the same thing here with hemp and cannabis. They're all cannabis plants. You have 3 different types of cannabis plants. 2 of them have very high or fairly high tetrahydrocannabinol. That's a fancy word for saying THC, which is the stuff that makes you high, that causes a psychoactive response that makes you high. So the hemp does not have, it has negligible amount of THC in it. Actually, that's why they call it industrial hemp, because industrial hemp is used for paper, for clothing, for many things, because it has such an extremely low dose of THC, or that tetrahydrocannabinol, that it's not going to affect you. You cannot get addicted to hemp CBD if you try, because there is no psychoactive response to it. So there's the crux of the difference. Cannabis CBD is from the plants that have the high THC, and the hemp is has no THC, or a very, very negligible THC. So the CBD and anxiety is what we're going to talk about. Now, you can see here, CBD significantly decreases the anxiety. Now, it depends on what state you're in. Some states have legalized marijuana and CBD. So those states, you need to get it from a dispensary. We are not about that. I'm not here to talk to you about that. I'm here to talk to you more about hemp CBD, because I don't want to get into those logistics. I don't want to get into that discussion or that argument, because that really is a personal thing, and that depends on where you're living. So the hemp actually can be purchased online, and it can be purchased only by somebody who's 18, because the cannabis CBD and the hemp CBD is governed by the federal government, because it's all a cannabis plant. So that being said, the hemp is more readily available, and you can get it. Just be careful of your state's regulations, but here in New Jersey, you can use hemp CBD oil. What's great about this hemp CBD oil is that, again, you have no psychoactive effects, but you're reducing your anxiety, and you're reducing inflammation and pain. And actually, some of the studies are even showing that the IOMT just put a paper out not that long ago, that it, or not a paper, but they were talking about how it can actually hopefully prevent the onset of Alzheimer's. So there's a lot of medical benefits, but we're not medical people here. We're not talking about that. We're talking about anxiety. So it was shown that the CBD oil actually significantly decreased subjective anxiety. That's why I'm bringing it up. So if you want to use hemp oil, we don't have it here. We're not going to give it to you here. But if that's something you want to do for yourself at home, it definitely can help. I know stories. I know doctors that are using it in other states. Not the cannabis CBD, hemp CBD. And they're using it, and it's significantly reducing patients' anxiety to the point where one woman said her boyfriend was so fearful of the dentist he couldn't even call. So he took some of the hemp oil, and he was actually picked up the phone to call the doctor and made an appointment to see the dentist. So that being said, here we have another study that shows that it can treat short-term anxiety. So we're not here to treat long-term things. It's about getting you into the office and about helping you get over your fear and anxiety. So, and then here, what's great about it, it has few or no negative side effects because you're not, especially addiction, because you're not going to have the side effects of the medications for anxiety like Xanax, Valium, and all that stuff. So it's a nice additive to your armamentarium if you choose. That's not something we have here, but we have everything else. Okay. Now, here's another wonderful, wonderful way of reducing your anxiety, and that is through using NuCalm. Now, for those who don't know what NuCalm is, it is a multi-layered system that helps put you in a meditative state, which I think all of us would love to be in, I'm sure. And you're not going to get all loopy and high and off on it. So basically, NuCalm, it was made by Solus Life Sciences because they wanted to find a way of being able to help people in the medical and dental fields that can help get through that anxiety state, that high, where your amygdala is all firing off, right? The midbrain, that fight or flight. So being able to quiet that without giving you anything that's going to potentially harm your system. So there's different systems, as you can see by this slide. There's a couple of different things that we do that will help affect that midbrain and lower that anxiety sensation. And this is a system that we have here. We've had it here for quite some time, and we've had amazing results with it. People were able to sit in a chair that never thought they could. So we love using it. So basically, what we do is we use a NuCalm cream, which has, it's generally recognized as very safe. And basically, this cream is GABA. I'm sure you've heard of GABA, and if you haven't, GABA is that stuff that, you know, when you're laying in the bed or you're in your recliner and you're just starting to doze off, that pre-sleep sensation, that's GABA. Your body's producing it. Your body's making it. So now they were able to get that and put it in a cream. So that cream, we are now increasing your GABA because when you have that midbrain firing off, like that fight or flight sensation, that your midbrain is going to stop that GABA. So you have to use a little bit more GABA, and then we have a way of being able to get that GABA into your bloodstream. So that GABA goes right onto your carotid arteries right here, because that is a very straight delivery system. So you're now going to be able to get that sleepy sensation through that carotid artery, since your brain is not going to make it since you're like in a panic mode. Then we use this cranial electrostimulation. So basically, these little pads that you see there go right behind your ear. You feel nothing but the pad there. So that little soft spot behind your ear on either side, because what that does is that electrostimulation causes that GABA to really get into your bloodstream. So now that GABA is going to get right into that midbrain, so you're going to start getting into that meditative state. It's a nice relaxing sensation. So as you can see here, this is someone who had the CES, or that cranial electro system, applied after she had the GABA put on her neck. The next thing is we have neuroacoustic software. So you have headphones that are hooked up to, the headphones we have actually has it pre-programmed in the headphone, so you don't have to worry about holding a tablet or anything. So you have music that actually has alpha and theta waves in it. So you're listening to music, but those alpha and theta waves sort of cancel each other out. So that puts you in a, because like one's at 100 hertz and the other one's at 112 hertz. So you play them together so it minuses each other out, and then you get about 12. And that puts you in that nice meditative state, that relaxation state. And the next thing, so here's, you're putting on the headphones. So the next thing you would need to do is, what about, this talks about that how the brain takes the two and subtracts, and it puts you in that 12 hertz, which is a meditative brain wave. So it takes things from going like this to now like this. So the eye mask or dark eyewear helps prevent the visual stimuli, which means you're not going to see the doctor or the hygienist coming at you with certain instruments, right? So if you don't see it, you're not going to have that stimuli. So we're now putting you in a meditative state, and if you don't see something that's going to reactivate, you're now going to be in that nice, calm, relaxed position to be able to get your dental work done. I used this on a patient last year, this guy Steve, and big guy, big strong guy. And he was very fearful of the dentist. I said, Steve, let me use the new calm on you. And he's like, oh, and I explained to him what it was. He goes, okay, great. So I put it on him. I was able to do the cleaning for him, did not move a muscle. He was limp as a wet noodle. And when he was finished, I took it off of him. And I said, Steve, how was your experience? He goes, oh my God, Fran, that was better than any dead concert I ever went to. That was awesome. He was so relaxed, and I was able to get done what I need to get done. So we had a very comfortable, thorough treatment, and then he had that nice relaxation feeling, which actually basically carried him through the day, because you'll have that nice Zen sensation for the rest of the day also. But you are able to drive, you're able to walk and talk, you're cognitively aware of everything, which is great, because we don't want to knock you out. So here is just a little schematic of how you can see how those electrical patches can cause that GABA to get into the midbrain. So we don't need to get real fancy here, but it shows you, this is a little scan that shows you how that works. So here you're hooked up to your new calm. She's nice and relaxed, and she's able to get her dental work done, still aware of what's going on, but not knocked out. So here it's been certified, FDA cleared, et cetera, et cetera. So this, again, there are studies showing that how effective this is, and it's very safe. It's considered generally safe. So it's a great thing. So here we have it. We have a list of things that we reviewed. We reviewed essential oils, your lavender and your orange oil, and how you can do it for yourself. We reviewed tapping, your EFT tapping, where you can be in full control of how you can manage your fear and your anxiety anytime you need to. Then we discussed homeopathy, which is an essence of a botanical that like cures like. That's thankfully to Samuel Hahnemann. He was able to help us help you kind of eliminate your anxiety. Then we talked briefly about CBD oil, how the hemp oil could potentially be beneficial to you in reducing your anxiety and such. And then new calm, which we do here for you also. So these are some 5 top things that you could use, and we want to actually invite you to come and experience any of these things, except for the CBD oil. Like I said, that's something if you want to do on your own here at the dental office, because we want to be able to help you get the work that you need. So for those of you who have not been to our office and would love to know more about what we do and be able to experience the new calm or any of the homeopathy, we have a webinar special. We have a $99 new patient special for a full exam and x-rays and a holistic cleaning, which involves a lot of great things like ozone and herbal solutions and such. We want you to call and contact us and be able to make an appointment. And that number is 973-379-9080. And we want to be able to help you as much as we can. Again, that number is 973-379-9080. And I hope that this webinar was helpful to you. And I want to thank you for your time, and I want to be able to help answer some of your questions. So I want to be able to pull up the chat. Okay. All right. Where do you get the inhaler container? You can get that online. You can get those actually from Amazon. You can get a bag of like 20 of them, which I don't think you need 20. But, you know, I last I saw it was like a bag of 20 for like $8.50. So they're like 42 cents a piece. So I'm sure there's on Amazon, you can buy everything on Amazon. You could probably find less than 20 for very, very cheap. You probably, I mean, if I can buy 20 for 42, you can probably buy it for $1 or $2 a piece. You know, just Google it, you know, a personal inhaler, and it'll come up, I'm sure. You'll be able to get them. Also, the empty rolling ball container, again, you can get those on Amazon. Okay, you have your two factions. You have your doTERRA faction, and then you have your Young Living. I use both, but I'm a doTERRA faction. So I use doTERRA a little bit more. So I was able to get roller balls through doTERRA. They're a little more expensive when you go through the essential oil company. So again, you can just Google in rollerball for essential oils. Just put that in your Google search or whatever search engine you're using, rollerball for essential oils, and they'll all come up, and then they're varying degrees in price. You can probably get one for a couple of dollars. I have a couple at home because I use different essential oils for different things. Like I have one for focus, one for this and that. So, you know, there's an easy way, but Amazon's got pretty much everything. Okay. And when do you do the tapping? Okay, you can do the tapping, like I said earlier. You can do it anytime you want. You can do it the night before, or even if you need to do it for, depending on the level of anxiety, if it's really significant, I'd probably start maybe a couple weeks before. Work on it a couple of times, because each time you do it, you're reducing your anxiety level, because once you say your stressor, you know, your dental, you know, my dental anxiety, once you say your stressor, if you've done it enough times, your stressor is not going to activate that midbrain as much. So depending on your level, but I would say minimally the day of and the morning of your appointment, and you can do it right before you leave the house. You can do it even in the chair. You can do it anytime. Okay, so that's the best answer. So it really depends on your level of anxiety. All right, and then where do you get hemp CBD in New Jersey? Basically, you can buy it online. Just be careful of what you buy online. I'm not going to recommend any place. I know we have CBD, the Cannabis CBD dispensaries, but you have to get a prescription for that, and it's we're not into doing that. But the hemp CBD oil you can get online. Just make sure you get one that is very, very clean, very clear and clean, because you can buy it on Amazon, I believe. You can buy it online. A lot of companies are selling it. But you want to make sure, and this is a word I want you to write down, you want to make sure that they have a high bioavailability. I'm going to say that again, bioavailability. Bioavailability means that it really gets into your bloodstream really well, and it's a clean substance. You don't want stuff that has a lot of junk in it, because if it has a lot of junk in it, that junk's getting in your body. So that high bioavailability means it's going to get into your system relatively quick. And there's different ways you can take it. There's you can use the droppers. There's a tincture. You can use tablets. The tincture, I think, works a little bit better in that you would use the least amount that you would need. So you go by what their manufacturer recommendations are. So I'm not here to give you a specific amount. That's something that you would have to find out from the manufacturer what they would recommend. So I hope that helps. I don't mean to be a little ambiguous, but I don't want to give you specifics that I don't have, not being a doctor, but I do work with people that do use hemp oil and have great results with it. So that's something you can get online, but bioavailability is important. Okay. Any more questions? Any more comments? Because I'll be happy to ask or answer any of them. No? Well, then guess what? You're going to need to come in to see us here at the Holistic Dental Center so we can help you get healthy and stay nice and calm and get like Steve. We can put you in a nice Zen state for many ways. I want to thank you for spending your Thursday evening with me. It is always my pleasure and my honor to be able to deliver these to you, whether I'm moderating or I'm giving them. And those of you who have been here for our events, you know how I love to help people. So I want to thank you again. I want to ask that you know, if you have any questions, can call us, 973-379-9080. Or if you want to even email, you can email inquiry@drgdds.com, and we can even answer your questions via email. Again, it is my honor and my pleasure, and I hope you have a wonderful evening, and stay relaxed. And namaste.